We are doing angina in biology. Is that the same thing as what Uncle had? Because his was a heart attack, wasn't it?
Yeah, that's right. They're similar, but at the same time, they're actually quite different things. They're both related to the arteries of the heart and the underlying process. Angina, I suppose, is the heart telling you that there's something not quite right. And a heart attack is when something has acutely gone wrong.
So where does it all begin?
Well, it's a process called atherosclerosis. That's the build-up of fatty deposits on the walls of your arteries. Think of it like limescale in the pipes of your house, building up slowly, often over decades, and that slow process leads over time, and often you won't feel anything at all. And the arteries that we're concerned about are the coronary arteries. Those arteries supply the muscle of the heart, and the heart as a muscle needs a constant supply of blood to keep it functioning and working well. So as the plaque builds up gradually, the artery begins to narrow, and while you're resting, the heart can still get enough blood supply. But when you start pushing yourself, climbing stairs, exerting yourself, the artery, because it's narrowed, simply can't keep up and supply the heart the muscle it needs. That mismatch of blood supply that it needs causes the symptoms of chest pain, which is angina.
So angina is just the heart struggling to keep up?
That's exactly right. It's how the heart's signaling to you that it's not getting enough blood supply when you're exerting itself. It presents with a heaviness on the chest when you exert. Sometimes can go up the neck or go down the arm. The important part is the relationship to exertion. It comes on when you exert yourself and is relieved when you stop. So importantly, with angina, the heart muscle isn't damaged. Yes, the artery's narrowed and the heart is struggling, but the artery hasn't blocked like a heart attack.
So what's different about a heart attack then?
Well, a heart attack's actually quite different. In a heart attack, a piece of plaque, it doesn't have to come from a very large amount of plaque or a very narrowed artery, just a tiny bit ruptures and breaks off, and the body tries to patch that rupture up by forming a clot, and that clot completely occludes the artery, blocking it off. That area of the muscle that artery supplies starts to become damaged because it's not getting enough blood. So what surprises a lot of people, it's not always the biggest blockages that cause heart attacks. Sometimes a relatively small amount of plaque can become unstable and block. And that's why it sometimes can be a bit of a surprise when heart attacks occur with people who have not had any symptoms prior to that. So it's not always about the degree of narrowing or blockage, it's actually about the stability of plaque that predicts whether someone's going to have a heart attack or not.
So what causes a plaque to build up? And what makes it rupture?
That's actually a good way to think about it, Lara. So, what causes it to build up? It's probably the risk factors that we all know: being overweight, high cholesterol, diabetes. Family history plays quite a big part as well. And what makes a plaque unstable or more likely to rupture is largely down to inflammation. Smoking plays a big part. Smokers have very unstable plaque, likely to cause a heart attack. Other things that we know, high blood pressure can lead to plaque rupture and cause heart attacks. And also the plaque itself, if it's made up of soft, rich in fats, we've seen that they're more likely to rupture, as opposed to the plaque that builds up with time that's full of calcium, which tends to be more stable and then lead to angina.
So how do you treat it? Is it always a stent or an operation?
No, that's actually what surprises a lot of people. What I would say the most important treatment in patients with angina and coronary artery disease is actually medications in the first instance. First, medications to treat angina. We can give tablets to improve the blood flow to the heart, and also two, tablets to slow the progression of build-up of more plaque. That's where statins are really important. So statins don't just lower cholesterol. What we found is that statins stabilize plaque, reducing the risk of heart attacks. And a stent is a metal scaffold that we place in the artery through the wrist or the groin, and it's a very good angina treatment when medications don't quite control it. What's important to note, in stable angina, stents don't reduce the risk of future heart attacks, and that nuance actually does matter. And then there's bypass surgery. This is good for patients who've got lots of narrowings or narrowings in all three of their major arteries. And this is where we take vessels from the other part of the body and we reroute around the blocked arteries. But that's an open heart procedure. And as mentioned, bypass is usually suitable for patients who've got narrowings in multiple arteries or particularly diabetes. And that's where it's shown for patients in those scenarios tend to do better on the long term compared to stents.
So how does someone know which one they need?
Well, it actually depends. It depends on your scan findings, your symptoms, and your risk factors. There's no one right answer for everyone. There's only the right answer for that individual patient. So if patients are having angina, they should see their GP and see a cardiologist to see if we can make that better.